Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. On the Senate Veterans Affairs Committee, or the U.S. Senate Committee on Veterans Affairs website, I found some information here on some legislation that is being put out to improve some aspects of VA in coordination with other benefits. And I wanted to share it with you so you are aware of this legislation. If you support it, whether you need it today or you might need it tomorrow, if you support it, reach out to your congressional members. Let them know that you support this legislation, both on the House and the Senate side. Vitally important. Please hit the thumbs up, subscribe, share with a friend, all that good stuff. I truly appreciate it. The two asks to really look. Hit the thumbs up and let the video run. If you want to support the channel in other ways, consider being a member. I do my best to get back to you in the comments. Thank you so much to all you members for your support. I really do appreciate you. All right, so the headline here is Senators Moran, King introduced legislation to improve care coordination for veterans using VA and Medicare. I've been doing a few videos on Medicare because, look, we're none of us are getting younger, and a good portion of us are already at that age, whether it's for us or for our spouses. What I will do here is I'm going to put two different links in the description and in the comments. And one is for any sort of medical evidence that you need on the VA side. That's through AME, American Medical Experts. They can do a free consultation for you and get you the information you need. The other is completely free to you, your spouse, your parents, whoever, for Medicare information. It's absolutely free for you to make sure that you or your loved ones are on the right Medicare plans. And oh, by the way, the VA encourages folks to be enrolled in Medicare to have kind of that double coverage aspect going on. So anyway, let's jump into it here. U.S. Senators Jerry Moran, chairman of the Senate Committee on Veterans Affairs, and Angus King, member of the Senate Committee on Veterans Affairs, introduced legislation to better coordinate and manage health care for veterans who are enrolled in both Medicare and the Department of Veterans Affairs VA healthcare system. Millions of veterans are enrolled in both Medicare and VA healthcare systems. These dual enrollees often experience gaps in care and difficulty managing services from two government agencies. The Coordinating Care for Senior Veterans and Wounded Warriors Act. That's the name of it. It's a long one. It will be in the description. The Coordinating Care for Senior Veterans and Wounded Warriors Act. You can call, email, leave a message, show up in person to your congressional member and let them know. All right, what would it do? It would create a 3-year pilot program where veterans who are enrolled in both Medicare and VA care, VA health care, would be assigned a case manager to help them develop individualized care plans and manage the delivery of health care services in an effort to increase access to care, eliminate duplication of services, improve quality of care, and lower expenses for taxpayers. We have a quotation here. This is from Senator Moran. It says, helping veterans as well as their caregivers and providers understand and navigate both Medicare and VA healthcare will eliminate gaps in care, improve outcomes and quality, and lower expenses for taxpayers, said Senator Moran. The Coordinating Care for Senior Veterans and Wounded Warriors Act helps make certain veterans can fully use the care they qualified for and earned through their service. I am grateful to Senator King for co-leading this bill and our Veterans Service Organization partners for their support. I'm going to throw this out there. If you're not signed up with a veteran service organization, I get it. Look, not everybody wants to go to the meetings. Sometimes they're on funky time frames. Maybe you don't want to go to certain events. Maybe you just kind of want to stay away. That's okay. You could still sign up and just never show up. It gives another body, another head count for lobbying efforts at the Capitol. That's all I'm saying. All right, moving on. Our veterans gave their another quotation, this is Senator King, our veterans gave their very best while serving, and they deserve that same focus in return long after they have hung up the uniform, said Senator King. Navigating the VA healthcare system is already challenging enough, but for veterans who also receive benefits through Medicare, it can be extra difficult to navigate between the two providers, both for veterans and caregivers. The Bipartisan Coordinating Care for Senior Veterans and Wounded Warriors Act will work to seamlessly merge and coordinate care between the VA and Medicare, helping to connect the dots for former service members, eliminate duplicative services, and lower costs for taxpayers. It's a win-win across the board. There's a quotation from Wounded Warrior Project. Wounded Warrior Project is pleased to support the Coordinating Care for Senior Veterans and Wounded Warrior Access Act, said Jose Ramos, Vice President for Government and Community Relations for the Wounded Warrior Project. Innovative pilot programs like the one envisioned by this bill will help us better understand what's possible in our effort to improve the systems of care that support our nation's heroes. With better case coordination and healthcare outcomes as the goal, this pilot program can help younger veterans who use Medicare earlier in life because of a catastrophic injury from their military service. We thank Senators Moran and King for their vision and leadership on this issue and urge Congress to pass this important legislation. We have to do our part as well. We got organizations lobbying for it on the Hill. We got to do it at the district level. Send an email, make a phone call, show up in person, and that's what you do. Next quotation here. Many veterans with disabilities rely on both VA healthcare and Medicare to meet their healthcare needs, said Heather Ansley, Chief Policy Officer of Paralyzed Veterans of America. This can lead to a duplication of care, poor coordination of services, higher costs, and in the worst of cases, endangers the health and well-being of the veteran. PVA supports the Coordinating Care for Senior Veterans and Wounded Warriors Act, which tests VA's ability to coordinate and manage care and benefits between these two systems for covered veterans. AMVETS proudly endorses the Coordinating Care for Senior Veterans and Wounded Warriors Act, said Joe Chinley, the National Executive Director of AMVETS, ensuring easy access to healthcare services and seamless system is essential for all veterans. There's a multitude more. I'll just do one more. We hear from caregivers every day who struggle to navigate the complex system of available VA services on behalf of their loved ones, said Steve Schwab, Chief Executive Officer of the Elizabeth Dole Foundation. Too often, this means that the veteran is unable to access needed care, and the caregiver suffers added stress, anxiety, and frustration. Therefore, we are pleased that Chairman Moran and Senator King are joining together to reintroduce the Coordinating Care for Senior Veterans and Wounded Warriors Act to help these especially vulnerable veterans and their families connect to vital programs. All right, the champion legislation was introduced in the House, companion legislation was introduced in the House of Representatives by Congressman Juan Cisomani, Donald Davis, and Michael Turner. So this is both on the House and the Senate side. Again, if you don't want to talk to anybody, call after hours, leave your congressional member a message, or you can send them an email, or you can swing by in person, talk to them, and let them know that you support this. Look, there's many loud groups out there. We need to be one if we want things to actually get done. With that, thanks so much for watching. I appreciate every single one of you. Have a great one, and remember, if we don't take care of each other, something went wrong.